Okay. Just check the ye old YouTube. Make sure everything's good there. And then we'll share it and get going. Sorry for the delay, folks. Okay. Okay, I think that's good. So we're just going to share this and get moving, okay? Thank you for your patience as we get started here. Sometimes things don't happen the way you plan them to, and that is A-okay. Okay, here we go. Just going to share this on Twitter and we're going to get going. Okay. All right. I see that Jonathan has already joined us. Good to see you, Jonathan. Enjoy the sprints while we chat and hang out. It's always nice to have friends who come hang out. You know? For sure. All right. Well, good afternoon, everybody. I am, I guess, technically Dr. Patrick Lockwood, but for the purpose of this podcast, I'm just Patrick. Please don't sue me, etc., etc. I am acting of my own free will to say and do things to help people. That is the whole purpose of this. I am not here acting as a professional. I'm here acting as just myself. So welcome to UnShrink Me. This is, I believe, episode 34, if I'm not mistaken. And today we have some interesting things to talk about, including especially AI therapy. I'm very interested in this topic. So welcome, welcome. If you are brand new, UnShrink Me is just a podcast. It's a weekly podcast where I talk and people comment and we chat and discuss everything related to clinical psychology, mental health, psychiatry, and things like that. I have extensive experience as both a professor and a clinical psychologist and a guy who's run treatment centers. So I have lots of professional backgrounds that help inform my perspectives. So this is a podcast dedicated to creating a more informed consumer base. The whole goal here, literally, is to create a consumer base that is educated enough that understands exactly what the purpose of different types of therapy services are, what the research says about a particular idea or not, what is clinically generally useful or not, and to just generally debunk bullshit that's out there in the real world that might be hurting people or maybe at best just not helping people. So that's the purpose of this podcast. Please like, share, and subscribe if you find anything I say or do useful here today. So like I said at the beginning, we have at least one very interesting topic, which I'm going to try and expand on a little bit, which is AI therapy or AI-assisted therapy, which is a completely confusing concept to say the least. And then after we talk about AI therapy, I'll talk a little bit about men. We'll talk a little bit about probably Jonathan Shedler, maybe Justin Garson, maybe Dr. James Davies, maybe Lori Gottlieb. So we'll start off with some of these simpler, easier ones to play with and maybe debunk. And then we'll move on to the topic du jour, which is, AI therapy. So on the simpler side, let's start with an easy one. This is an easy one. So I'm going to retweet this right now and just share some thoughts, generally speaking. Okay. So the person whom I've never met, so I don't know who this person is, Carolyn Johnson on Twitter at CarilynJohnson, Carolyn Johnson, said on 8/22, I just finished the Karen Carpenter documentary, famous musician. The answer lies in the lack of understanding. So many now ask, how did people allow her condition to become so dire? And she said the answer lies in the lack of understanding and unwillingness to confront the very real mental health condition from which she was suffering. People went along with her claims of exhaustion. No one wanted to be unkind. And by the time they were willing, it was too late. I could not escape the obvious parallels of how we are repeating this destructive empathy with today's body dysmorphia. And so, the idea is kind of not super tricky or anything, but I just want to share some very superficial thoughts because I don't know Karen Carpenter. I don't know her story all of that well, but basically, at the chance of, libel or slander or whatever, here's what I will say. And you don't have to agree with me. This is not me trying to backseat diagnose or treat or whatever a famous person I've never met, just so we're clear. But just to talk about Carolyn's post real quick. So she said, so theoretically speaking, again, the main story is Karen Carpenter at one point died of anorexia nervosa, or at least that's the story as the way it's like written in Wikipedia or whatever. So Carolyn said, the answer lies in the lack of understanding and unwillingness to confront the very real mental health problem from which she was suffering. And so just to put some nuance to this, there's a lot of people, genuinely speaking, who are struggling and suffering with different types of mental illnesses, depression, PTSD, eating disorders, so on and so forth. And they need help for sure. It's very hard, especially for, believe it or not, celebrities to get the help that they need. And one of the reasons is because of the insane pressures they face by family and friends alike, the industry, and the requirements of their job more generally to just keep functioning and keep producing, whether you're a musician or an actor or whatever it is. And so I can tell you, living here in LA for the last 15 years and working with people, sometimes famous people, what I can tell you is that although rich and famous might sound glorious to a lot of people, what I will tell you very straightforwardly is, although it is nice to have lots of money and be famous, it's definitely not nice to constantly be scrutinized in every way, shape, and form, number one. But number two, and maybe even more importantly, it is horrific. It is hard for people when they become a commoditized thing and they're dehumanized, I guess you could say, to be more technical about it. So it's very important, very, very important that, we speak with a lot of understanding when we talk about these celebrities that we've never met, because it's not always clear what these people are actually going through. So like, did Karen Carpenter actually have a formal diagnosis of anorexia nervosa? I have no clue. I couldn't tell you. I haven't thought that deeply about it because I don't pay attention to celebrities unless I'm specifically working with them. But if she did die of an eating disorder, it's not uncommon at all for there to be all sorts of systemic issues related to anorexia nervosa. Like, it's very clear from the psychiatric and the psychological research that people with eating disorders often come from very dysfunctional families. So we're not blaming the family per se, but the problem is, if the family, kind of like Carolyn said, if the family cannot have normal, healthy boundaries with these people who are mentally ill, then what will happen is, generally speaking, their illness will at least maintain or in some cases get worse, right? So until you do something systemic to help fix these problematic communication patterns, boundaries, or expectations, it's really, really hard for very ill people to get better. That's true for people with schizophrenia, anorexia, serious drug addiction, whatever it is. This is not an individual illness. This is a family systems illness. All of these are family systems illnesses, and you can't just treat the individual in isolation. And so it's generally the case that Carolyn's probably correct in her original post, to some degree at least, that, the family systems around her didn't actually have healthy boundaries with her to some degree. And that's probably not the reason she died from anorexia nervosa, if that's why she died. But it's probably a contributing factor, right? And so we shouldn't blame the parents. We shouldn't blame the system no more than we should blame the individual. We shouldn't be blaming anything. If you're an actual professional, blaming is stupid. That's not our job as professionals. Professionals should never be publicly or privately blaming anything. Yeah, there are screwed up families. There's screwed up parents. There's screwed up spouses. And the individual themselves might be very mentally ill or selfish or whatever it is. It doesn't really matter. What matters is actually looking at the entire person and the entire system and trying to see everything that can be managed or modified to help the person recover. Right. So I do agree with the soft version of what Carolyn said, which is, yeah, we probably should have had more help for the system that was impacting Karen Carpenter, but blaming the system is silly. And to call gender dysphoria, body dysmorphia, I don't think that's fair either. So I have some disagreement with you, Carolyn. If you ever see this podcast and you want to come talk about it, let's talk about it. But, we can't just blame the family. We can't just blame the parents. You can't just blame the spouses. You can't just blame the employers. You can't just blame. You have to talk honestly like an adult about all the complicated layers of family systems and expectations and culture in the industry that Karen Carpenter was a part of and all these things. There's so many variables as to why someone's mentally ill or even dies from mental illness, right? By the way, not formally sponsored by Celsius. So that's that. Thank you, Carolyn, for providing a little grist, for the mill. All right, I'm going to talk about something very controversial. I don't know if I'm going to do it well. We will see. And I kind of talked about this on the men's podcast on Thursday with Ryan Rogers and Jake Wiskerton and Systemic Texan and all these guys, Jonathan Cogburn. And I think it's a worthwhile one to just reiterate because this topic comes up a lot online. Just going to finish tweeting it. Okay. So this is from a person called Bow-Tied Sales Guy at Bow-Tied Sales Guy. He said, bad therapists, and this is August 22nd, he said, bad therapists enable their clients in all sorts of ways that absolve the clients of self-responsibility, in parentheses, often because therapists don't take responsibility themselves. There's also a financial incentive to keep you stuck, too, for the recurring revenue. A good therapist can change your life forever, though. It's one of those fields where the difference between a good one and a bad one is massive. So, dear bow-tied sales guy, I agree with you about at least your second point, which is there's a huge financial incentive to keep you stuck, too, for recurring revenue. In fact, I would argue that a lot of therapists that do not talk to you sooner about boundary issues or what they think the hypothesis is that drives your mental health symptoms or whatever it is are doing so because they don't know how to effectively work with people because they're terrified of losing revenue. I think a lot of therapists are very afraid of losing revenue, and I don't think that's unusual. And I think that the more people talk about that out loud, the more we can be accountable as a clinical culture. And so I think more conversations about that would be good, Jonathan and Ryan and friends. I want to talk about the first point, though. He said again, in quotes, bad therapists enable their clients in all sorts of ways that absolve their clients of self-responsibility, often because the therapists don't take responsibility themselves. So let me say this as clearly and simply as humanly possible. Clinicians of all degree levels, psychiatrists, psychologists, LMFTs, LPCCs, whatever the degree, whatever the age, whatever the gender, whatever the sexuality, doesn't matter. All clinicians are human beings. We're irregular people, unfortunately, for all of you. So because these professionals are also just regular people, whatever your regular person failings are will have consequences for your professional life, right? So I'm going to try and say that one more time just so it's abundantly clear to everyone that I'm trying not to be rude necessarily. So because clinicians, psychiatrists, psychologists, etc., are just regular people who happen to have a degree, training, ethics boards, all these things. But just because we have all those things does not mean we're not regular people, by the way. So if you are a consumer, if you're a patient of a therapist or a psychiatrist or whatever, please know that your professional is not some idealizable, perfect, or well put together person. They are regular people who are hopefully on their own journey of getting better and living better and healthier and all these things. So therapists, clinicians, psychiatrists are regular people. They might be a little smarter. Some cases they're not. They might be a little more insightful. Many cases they're not. They might be, more experienced. Some cases they are. Some cases they're not. In managing these mental health problems, etc. But here's what I will tell you. What bow-tied sales guy said is 100% important and not talked about in graduate psychology very much. I'm very proud of the grad psych program I teach in because my colleagues are all good about this topic, but I know a lot of people that come from grad programs that are not taught about this topic. So let me say this abundantly clearly. You as a professional, if you are a psychotherapist, a psychiatrist, whatever you want to call yourselves, if you're a professional with a degree and with a license, it is your job, ethically speaking, legally speaking, to be in good standing with your license, to put some work into being a healthier person. It is your job to get better. It is not your job to sit there and stagnate or to enable your own failings as a person. It is your job to look in the mirror and go, in what ways can I do better so that I can do better work for my patient? So again, we don't have to be perfect. I've never once on this podcast or in supervision with my supervisees or in grad school, I've never once said anything remotely like you have to be perfect to be a good therapist. That's not what I'm saying. What I'm saying is, it is our ethical duty, once we are aware of some problem of ours, whether it's a diagnosable problem or just a failure of being a regular person problem. Doesn't matter what it is. It is your ethical duty. It is my ethical duty, once I'm aware of something, to do something about it. And when I do not do something about it, I am failing to live up to my ethics code. I'm failing to live up to the standards of professional practice, and I'm just not being a good clinician. I'm not actually giving a shit about the patient. Because the healthier I am, whatever that really means, but the more integrated I am, the more regulated I am, the more aware I am of my countertransference issues, etc., then the better I can actually be of service to the patients that seek out my services. So it's genuinely the case, as bow-tied sales guy says, that so many people in the profession are terrified of taking responsibility for whatever their issues are. It's your childhood stuff. Society didn't love me enough. My parents didn't love me enough. I'm resentful about this, that, and the other. If you're a therapist and you have unresolved resentment, you are part of the problem. You need to get a handle on that. Because if you don't get a handle on that, you're going to hurt people. So it's very, very important. Whatever your personal failings are, it's okay to be normal and it's okay to have personal failings. And, it's also your ethical responsibility to get your shit together. It's your ethical responsibility to take a look in the mirror and go, okay, I don't want to take accountability in this area of my life. And because I don't want to take accountability in this area of my life, I probably am not helping my patients very much in this area of their lives. So just to make it super concrete, if I personally am not willing to take accountability for like my eating behavior, maybe my relationship with food sucks. Maybe it's just terrible, right? And so if my relationship with food sucks as a person, then it's 100% the case that that's going to be a blind spot with my patients. Whether or not they have an eating disorder doesn't even matter. Now, if they have an eating disorder, that's even worse, right? And so it's very, very important for me as the professional as a professional psychologist, and myself in particular, it's extremely important that I take a look in the mirror and go, why is this a soft spot? Why is this a blind spot? Why does this matter to me? Why does this not matter to me? Whatever the case is, whatever the specifics are, doesn't even matter. Ethically speaking, it is our job as professionals to take a look in the mirror and go, oh shit, that's something that I have failed to actually take responsibility for, and I need to take better responsibility for it. And you know what the brilliant upside of this is that, and this is supposed to be encouraging, by the way, if you take more responsibility for whatever it is that you're struggling with, if it's your relationship with your family, your relationship with your friends, your spouse, your relationship with money, food, sex, whatever it is, doesn't matter. Once you start to improve that, not only will you as the professional feel more empowered, but also you'll be able to help your patients more. So everybody wins when you get your shit together. Nobody loses. Everybody wins. Your reputation gets better. You help your patients better. Your personal life gets better. Everybody wins. So, dear future therapists, people about to go into grad school, dear people in grad school, dear licensed therapists of every degree level, dear fucking psychiatrists, please get your shit together. Whatever it is you're resentful about, whatever it is you don't want to take responsibility for in your life, because none of us are perfect, me especially, obviously, listen to me, but none of us are perfect. And so please take responsibility. Take more and more responsibility. Do better to take care of yourself. And it will allow you to be better at your job. It'll allow you to be better at being yourself and taking the best care of yourself. Nobody loses when you take more responsibility and you fix your life as a professional. As a professional, the more you clean up your personal shit, the better your personal life gets and the better your professional life gets. I promise you. I can tell you as a clinical supervisor who's walked supervisees, pre-licensed interns through this process, their lives get better. It's amazing. And so I promise you, there's no downside to taking more responsibility, and you'll enable your patients less. You'll harm your patients less if you take more responsibility for whatever your shit is, whatever you're resentful about, whatever you don't want to take responsibility for, it'll get better. All right. What did Jonathan say? Because Jonathan chimed in. Thank you, Jonathan. He said, for Ryan, he said, bring that Bohemian in structural family therapy. That's right. As an LMFT, he says, I fully believe that I have unintentionally reacted to the systems I inhabit in suboptimal ways that I'm totally unaware of. Yeah, it's true for all of us, right? He said, I will do my best to shrink that number as much as possible across my own lifespan. Yeah, I think that there's a normal human component to this that I want to just reiterate one more time so this doesn't sound unnecessarily harsh. Because clinicians are regular people while they're simultaneously professionals, they're going to have personal failings. They're not going to be perfect. I am not perfect, etc. So the expectation is not that we be perfect in order to help patients. The expectation is once we are aware of something, we do something about it and we improve it. We make it better. We take care of ourselves better. We have better boundaries with that topic or that issue or that feeling or that memory or whatever it is. That's our ethical mandate. All right, let's see. Should we move on to the topic du jour or should we wait? Let's see. Let me just double check, make sure I have not skipped over anything interesting. That's good stuff. All right, let me do a little Justin Garson, then we'll get on to the main topic for today. Oh, Lord. Good old Justin. Okay. So Justin Garson, who I've talked about before, his handle is at Justin, Justin, _Garson. Justin said on September 28th, he said, the main way psychiatry keeps us sick is by turning life's problems into, in quotes, disease entities that somehow reside in your brain and require their expertise to treat. It's not science, it's pure shamanism. So, like many of the things that I've talked about in this podcast with regard to Justin, let me say that, again, I don't know which professionals he has met in his life, personally or professionally. He might have met really bad narcissists who are psychiatrists who believe that you're so sick and you can never get better. He might himself be very ill. I don't know. I don't care what the truth is necessarily because it's not my responsibility to know some random stranger on the internet's life. So let me tell everyone this abundantly clearly. Mental illness is a real thing. I wish it were not a real thing. I wish it were just some massive, like, psyop made by the pharmaceutical industry, because I don't like the pharmaceutical industry at all, just so we're clear. So this is not me shilling for Big Pharma or something. I don't think I'm a fan. However, it is unfortunately the case that when you have a severe mental illness, like bipolar 1, for instance, or schizophrenia is often fairly impairing, or serious PTSD, or very severe drug problems that we call addictions. Like, these are real illnesses, right? Like, addiction's a real thing. And if you don't believe it's a real thing, watch what happens when someone's been drinking a bunch of alcohol for 20 years and you try to cold turkey it and they die from detox. It's a real disease. It's a metabolic disease in your liver, and it's a metabolic disease in your brain. Literally, not metaphorically. It's not just some fancy metaphor. Just like bipolar, although we can't perfectly identify the circuitry, there's 6 or 8 pretty good hypotheses with some good data behind them around dopamine, glutamate, and all these things in different pathways for bipolar. Same thing's true for schizophrenia. And so these are real illnesses. Now, people will debate, but like, what about mild depression? It seems like those people can just work out better and get better sleep, and then their sadness goes away. Yeah, those people might not actually have depression. And so the question just becomes like, if it's a real diagnosis, are psychiatrists just keeping people sick? No, that's not true at all. That's bullshit. I know many good psychiatrists that wish they didn't have to medicate people the way they do in order for them to stay stable or not hurt themselves or hurt other people. It's not complicated, you know? And so the problem, Justin, I have with a lot of what you say online is I want to meet these psychiatrists that you've met who are like Dr. Joseph Mengele or whatever, who believe that they're so brilliant and smart that they can just medicate you and make you a zombie, and that is how you're supposed to function. I don't think I've met one of those in my 15 years here. Now, maybe it's just because I've been in the Midwest and been in LA. Maybe it's just convenience sampling. I don't know. I've worked in psych hospitals. I've worked in fancy rehabs. I've worked in cheap community clinics. I've worked pretty much everywhere. And yeah, is part of the problem that general practice doctors are prescribing shit? Yeah, they should never prescribe an SSRI. I think it should be illegal for GPs to prescribe SSRIs. But like, I'm not a physician, so I shouldn't have an opinion or whatever, but fuck it. So for me, I think it's genuinely the case that so many people who need psychiatric help don't get it. People who are like floridly psychotic, maybe people who are homeless, maybe people with severe addictions. So like the top 5% of people who are mentally ill badly need psychiatric help usually. And the idea that they don't, the idea that they can just be like floridly manic, have pressured thoughts and racing speech, or racing thoughts and pressured speech, however you say it, I don't know. But like the idea that your insane grandiosity, like not normal grandiosity where it's like, man, I'm the shit because I just made $1 million, but like grandiosity that does not match your actual accomplishments as a person, that's bad for you because it makes you look terrible to the world and it puts you in risky, dangerous situations. You might drive too fast and die of a car accident. You might be impulsive. Impulsivity is a big part of bipolar 1. And so I am fearful on behalf of my severely mentally ill patients. I do not want them to die. And sometimes the terrible trade-off is they need to be a little more medicated to get psychiatrically stable so they can do a bunch of other things that will help them stabilize where maybe they don't need as many psych meds as they get healthier. That is unfortunately the ideal case for some people. But do those psych meds have consequences? Absolutely. Nobody denies that. Not even the psych drug manufacturers deny that. Nobody denies adverse effects of medications. So I don't know where these people come from. These anti-psychiatry folks are just confusing as hell to me because I don't know what they're seeing. I don't know who they're talking to. Maybe they're talking to grandiose narcissists who just think everything's great about psych meds. I've not met those people. And I've talked to lots and lots of medical professionals in my career. Some of them are lazy. Some of them aren't so smart. Some of them don't give a shit or are burnt out. Those are bad people. They need to get better. They need to do better at their job. But most people are just, like I said earlier, regular people trying to help, doing their best. Maybe they could read more of the literature. Maybe they could be more cautious about adverse effects. But it's not a question of whether or not psychiatrists are trying to keep people sick. That's bullshit. Psychiatrists are rarely trying to pathologize normal life suffering. I never pathologize normal life suffering, right? I never will. And I always tell my students in grad school that you should never pathologize normal human suffering, right? You should even be skeptical about diagnosing adjustment disorder in some cases. So it's really the case that I have no clue who Justin has talked to. I don't know who he's met. I don't know what his deal is. But I've never met psychiatrists who are like, by the way, I know you're kind of sad because your cat died. You probably have major depressive disorder. I've never met that person. I have never met that person. Maybe he's out there. Maybe there are pill doctors who just like run Lexapro pill mills or whatever. I've not met them. Maybe they exist. And if they exist, I'll eat my hat. I don't know. Anyways, just what the heck, Justin? Like, who are you talking about? Who are these people? Show them to me. Point them to me. Okay. So again, when you see anti-psychiatry folks on YouTube, when you see anti-psychiatry folks on Twitter, whatever, always think twice about why they're saying what they're saying. And if it's actually based on some kind of like real data, or if it's based on, some bias they have. Darren McGee says, when it comes to a diagnosis, I think clue in the word disorder. I think the clue is in the word disorder. The impact something has on their day-to-day functioning in the relationship. Yeah, exactly. So most of us with a spine and with an appreciation for ethics do not randomly diagnose all types of suffering. That's not how it works in the DSM-5. It's literally the case that it has to have functional impairment in your day-to-day functioning. And so all of us, I think, with a spine and an ethics code are like, yeah, this isn't actually a problem necessarily, even though you feel miserable. So it's not a diagnosis, right? That's how we all function. Jonathan says, you're not supposed to say never. Yeah, whatever, Jonathan. Whatever. Go back to sprints, Jonathan. Also, he says, I agree, don't pathologize normal life. Yeah, good. I think all of the sane people I've met in the profession are like, yeah, normal life happens. We get messed up because of grief or loss or big changes or whatever. And that's not a diagnosis. That's not a clinical problem. It might be a problem, but it's not a clinical problem. So dear future therapists who are like maybe getting into grad school or considering grad school or currently in grad school, there's problems and then there's clinical problems. Sometimes the two overlap, but a clinical problem has to have real significant distress and impairment in daily functioning. Okay? I think it's time to get to the topic du jour because this is an important one and I don't want to let it slip by because I think it's a huge deal. And this is horrific, just so we're all clear. I'm going to say the word horrific probably a few times. And it's really not okay. Like legitimately not okay. So we all have to be very careful. All right, so I think this was yesterday, if I'm not mistaken, or 4 days ago. Okay, 4 days ago, I was tagged in a post about this. But 4 days ago, this guy named Owen Gregorian, his handle is at OEWENGREGORIAN. Owen put out this article, this horrific article that says, and this is, I'm not going to read the whole thing because it's a very, very, very long post. And the article's from Technology Review, but on September 2nd. But essentially, here's a huge part of this article. He said, some therapists are using AI during therapy sessions. They're risking their clients' trust and privacy in the process. And he tells the story of this guy who lives here in LA who was literally on a telehealth therapy session, like over Zoom or something. And the therapist actually shared their screen. And the patient saw on the therapist shared screen that the therapist was typing in the patient's responses into Chat GPT. So I don't even know where I'm going to start here, but this is going to be a bit of a doozy, and maybe this is going to be okay for some of you or not okay. I don't know. But I had an immediately visceral reaction when I saw this. So let me try to sketch out the territory here. So as clinicians, we are ethically required in our informed consent process to describe all of the types of tools and interventions we are going to use or we think would be helpful with the patient. So first and foremost, this person violated informed consent. This therapist, whoever it was, violated informed consent by not disclosing that they were going to use a tool or a service. So Darren McGee just chimed in on the chat. He said, "What the actual fuck?" Yes, correct. So let me just spell this out one more time in case people come into this late. There's a story in Technology Reviews published on September 2nd that says that therapists, especially doing like telehealth on Zoom or whatever sessions, are using ChatGPT to find the appropriate way to respond to something a patient just said. And so there are probably 10 different reasons why this is horrific and stupid. But first and foremost, that violates the principle of informed consent. So it is illegal and unethical from just that perspective, especially if you're not telling your patient that you're doing that. Secondarily, you cannot know, it's impossible to know that if ChatGPT or other websites or other apps on your phone or whatever are picking up what you're saying as you're using them during your telehealth session. So the expectation of privacy is now automatically violated. And a third thing is, let's just say for the sake of argument that this therapist that was using ChatGPT never put any identifying information in there. So that would be the best case scenario of this terribly fucking stupid situation. But let's just say that at least there was no identifying information being put into ChatGPT. It's still a terrible idea because the internet lives forever, number one. And number two, these large language models are literally not trained on clinical data about how to respond. There are no clinical large language models. ChatGPT is not trained on clinical data. So this is horrible because what these models are trained on are like shit from Reddit. And Reddit is not exactly a bastion of mental health, just so we're clear. And so let me say, holy fuck. If your therapist uses ChatGPT to figure out how to respond to you, you should fire them. That is horrible. Secondarily, this completely defeats the purpose of any kind of training that you're supposed to do when you're in graduate psychology school. Because in grad psych, you're taught to do things like differential diagnosis or basic attending skills or very similar simple things that are hard to learn how to do. And so when you're using a ChatGPT kind of thing, if you're typing in shit while the patient is saying things to you, then you're not even attending. You're not even paying attention. Your full attention is now lost from the patient. So you're not even paying full attention to the patient while you're typing shit in to ChatGPT. So that's also terrible. Your job, the reason they're paying you all this money is because you're supposed to pay attention to them. So that's stupid and terrible too. So we've talked about 3 problems so far. Number 1, this breaks informed consent. It's illegal and unethical. Number 2, these large language models are not trained on clinical data, clinical decision-making, thought processes, so on and so forth. They're trained mostly on Reddit. Number 3, you're not fully paying attention if you're using ChatGPT to figure out what responses. So I just listed the 3 lowest hanging fruit. I'm sure there are others. Feel free to chime in, anyone who's watching or listening. But what the actual fuck? This is terrible. If you are a new therapist and you're anxious about your clinical skills, hire a supervisor. Most of us who have been doing this for a while love consultation and love supervision. Learn from the experts. Learn from people that have real experience doing it who are not Chat GPT. Also, if you're a lazy therapist, you should fucking quit. If you don't want to put in the full and appropriate effort to deal with your patients, go do something else. You should feel ashamed of yourself for using Chat GPT to talk to your patients. That is pathetic, unethical, unprofessional, and a sign of absolute laziness. And it is unacceptable. You should be fired and you should lose your license. And it's unacceptable in every way, shape, and form. It destroys the integrity of the profession when you invite AI into the clinical room. It's absolutely disgusting because that is not what we train. I have been a professor in grad psychology for like 8 years. That's not what we train. We don't train people to look at a chatbot to respond to patients because clinical psychology problems are not fixable with some factual finding from a chatbot. Let me just take a break and breathe for a second while I read what Jonathan said. Jonathan says, I think a lot about the risk to cognitive development in children and the maintenance of growth of cognitive functioning in adults from allowing AI to overfunction on their behalf. Yeah, I think that kids using AI is not maybe not the best thing for their development if they're going to be lazier and not overcome challenges the same way. I think there's a way to effectively use AI in situations where it's useful to use AI, but in the therapy session is not the time to ever use AI. Ever. I don't care what LLM is created. I don't care if some big medical company creates a psychiatric LLM. I don't give a shit. Never. It is never to be used in the middle of clinical work. Never, ever, ever. Jonathan says, systemic thinking tells me to expect risks as above. That's just in addition to what you're already saying, which I agree 100% with. Also, there's more pursuer distancy for it. Yes, exactly. More pursuer distancer for sure. That's an inside joke, clinical psych family systems theory joke. Anyways, so dear public, dear consumers of telehealth services, if you are seeing a psychiatrist by Zoom or some other telehealth platform, if you are on an app like BetterHelp or whatever, if you are on any kind of telehealth services, if you're not seeing your therapist in person or whatever, please, if you learn that they're using ChatGPT or something similar in session, run screaming from those persons. It's not okay. It's never okay because that person is at best, the best interpretation of this, the nicest interpretation is they're just insecure with themselves, which means that they're not professional enough to get the correct kind of consultation and supervision to be a better professional. You should leave them and move on. Worst case scenario, they're lazy and entitled, which means they are horrific. Dr. Rollergator says, ChatGPT says it disagrees with you. Well, Dr. Rollergator, if you even are a real doctor, I don't even believe you're a real doctor. So first, let's figure that out. Are you actually a real doctor? And can you roller skate? And are you actually an alligator or are you a crocodile? I want answers to all 3 of these questions. And I expect answers to all 3 of these questions, Dr. Rollergator. And then we can get to whatever ChatGPT says about my reactions to LLMs being used in therapy. Dear Dr. Rollergator. Dear Dr. Rollergator. Anyways, so for those of you who don't know what I'm doing right now, there's a person in the chat named Dr. Rollergator. And I don't believe that he's a real doctor. I don't believe he's a real roller skater. And I don't believe that he's a real alligator. But we'll see. He says, mysteries abound. They always do, don't they? They really always do. So, to recap, there are a variety of therapists. It's probably not just one person here in LA, but apparently there are a variety of therapists who are doing telehealth therapy, which means on Zoom or something, and they are not sharing their screen. But apparently this particular therapist with this patient, this therapist accidentally shared his screen to the patient, and ChatGPT was pulled up, and the person was typing in the patient's responses, to whatever the patient was saying into ChatGPT. So the therapist was relying on ChatGPT to inform what he was saying to the patient. That is not okay. I outlined at least 4 different reasons why that's not okay. Please be clear that this is terrible for the profession. It is at best going to not help patients because that data is trained on not clinical data and not consultation data and not supervision data. It's trained on Reddit and YouTube and all sorts of shit that's not clinical. So let me be clear to everyone. If you have a therapist that you're seeing on telehealth services via Zoom or whatever it is, they should never be using ChatGPT. If you see your therapist typing while you're talking or something like that, or if their screen is off, then they're not paying attention to you probably. So at bare minimum, that's just bad therapy because they're supposed to pay attention to you. So this is a horrific sign of the future. Just so everyone's clear. I'm not normally a fearmonger or anything like that because I think that humans are pretty resilient. The profession is doing okay. It'll get better, whatever. If this is allowed to continue, if people are allowed to continue to use LLMs during therapy, that's not okay. There's no way in which that is okay. This is horrific. It is horrifically stupid and dangerous and unethical. Jonathan says, who's held ethically responsible for a breach by an LLM? Will the LLM company be supervised by a state licensing board or have access to patients from remove? Right. So who's regulating these things? Nobody knows. We should not trust AI. We should not trust LLMs with patient data. We should just not. It's not okay. It's never okay. It's literally never okay. Just so we're clear. Literally never okay. So if you're in grad school getting your master's degree or doctorate degree in psychology or something, or if you're in med school becoming a psychiatrist, dear God, never use LLMs with patients. Never use AI with patients. Please never do that. Please do not do it. It's terrible for you. It's terrible for the patient. It makes you lazy. It makes you not pay attention. They're paying you to have a relationship with them. And who wants to pay you to have a clinical relationship where you're going like this all the time? Who fucking wants that? Or typing on the computer all the time. That's not what they're paying you for. They're paying you for a clinical relationship. The relationship is the best predictor of clinical outcome. Holy shit. So please, everyone, do not use AI. If your therapist is using AI, run screaming. Find someone who's not lazy and stupid. Find someone better. That's terrible. It's absolutely terrible. Absolutely terrible. I can't react strongly enough. It's just everyone should be losing their mind. If you're a mental health professional of any kind, if you're a medical professional of any kind, you should be losing your mind and screaming at legislators about this problem. This is terrible. This is a career-ending, profession-ending problem. And it's not okay. It is literally the death of what we all have called psychotherapy if this continues. And anyone who wants to enable this is an enemy of mine. And this is not okay. I think there's a rational case for using large language models for a bunch of other things related to documentation, insurance, and all that crap, but has nothing to do with what we do in the clinical setting, in a session with a patient. Holy shit. This is not okay. And I'm sitting here telling you that this is going to be the death of therapy if this is allowed. So please, if you're a supervisor, if you're a professor like me in grad school somewhere, if you have friends who are colleagues who are professors, please tell them about this. Please share this podcast with them or something. This is not okay. This has to change, and it has to change quickly. And we have to punish the people who do this harshly so that there's a crystal clear signal to the world that this is not okay behavior, because it's dangerous and unethical simultaneously. Okay? All right, that's all the ranting I can do about that for now. Or I'll probably say something that'll get me in trouble, if I haven't already. Okay. I want to finish today's conversation with a brief chat about men. So I had the privilege, I think it was Thursday, right? Thursday. Today's Saturday. It was Thursday. Yeah. So Thursday, I had the privilege of sitting down with Ryan Rogers, Jake Whiskerchin, Ed Perrin, and Jonathan Cogburn, who happens to be here. And these fine gentlemen had a chat with me about what therapy is, things like that. It was a great podcast. It's on Ryan Rogers' channel, so please check out his channel. Shout out to Ryan. And there's one thing that really stood out to me. I think it was near the end. I mean, a lot of things stood out, just to be clear. But one thing that really stood out to me near the end of the podcast was they were talking about this problem. And if you're in graduate psychology, if you're a licensed therapist of some kind, you know what I'm talking about, which is there are very few males in the profession, which I don't think is weird by any stretch of the imagination. I think it makes sense because of the kind of profession that it is. It probably doesn't cater to most types of people. But here's the issue. The problem that we face is I think it's one thing to say that there's a lack of masculinity in the therapy profession. There should be more men in therapy. Maybe, maybe not. I don't know. I don't feel that strongly about that particular take. But I did say something that is on the more maybe not controversial side to some people's ear, but controversial to other people's ear. So what I said was, I don't see the problem as masculinity in therapy. I think certainly there's a case to maybe argue for maybe a little more male participation in therapy. But I think the bigger problem is that in society, there has been a demonization of men and masculinity for about the last 20 years, maybe longer, which is fine. You know, I think that there's good cause to criticize sick men who use masculine traits for narcissistic purposes like Andrew Tate and things like that. I don't have a problem with criticizing those guys because they are genuinely gross. But I think it's been an overcorrection to the point that males have been, let's say, how would you say? They've been demonized to the point that now you're going to see this other problem, which is in the wake of all the sometimes valid, sometimes invalid criticism of men, we've created this vortex, this giant gaping hole in society, which is where is masculinity and can we use it effectively to craft culture in society, just like the appropriate amount of femininity is helpful for crafting culture in society. So the lack of masculinity is part of the problem that I think all of us agree with. And so I don't think the issue is there aren't enough men in therapy. I think the issue is there aren't good men in society who are getting the attention they deserve for trying to be good men, right? And I even include good trans men. I welcome all kinds of men into the experience because if you're a good masculine role model as a trans male, awesome. fuck yeah. Welcome to the club. Let's do it. Let's go. And I do not want any good masculine role model to be excluded from the process because we just have a lack of them. There are so few of them. And so, like I said kind of last week, I genuinely want you, if you're a male and you listen to this podcast, I hope that you understand how important you are because of the vacuum in society that currently exists, at least in the United States, where everything is stupid and politicized and all this shit. Like, if you're just a basically decent guy and you're trying your best to be a good guy and you do your job well, or you're a good dad or husband or boyfriend or whatever it is, please go out there and be part of other men's lives so that you can rub off on them and influence them to be good guys, because we need that. Because I don't think you need a bunch more men in therapy to fix that problem. I don't think therapy is going to fix society. I think that's a stupid perspective. I'm not here to fix the world. I can barely even affect change in the businesses that I consult for. We don't have that much power. Even if I became famous tomorrow, I still wouldn't have that much power. It's the case that in order for society to get better and to have a better relationship with masculinity, we have to have more men showing up in the world and being better men to each other and being accountable to each other and helping each other. I think that is what will help. So I don't think at all that there's a crisis of masculinity in therapy. I don't give a shit what the gender composition is of clinical psychology services or psychiatry services. I care that society is lacking in masculinity in important ways. I don't put it on therapy, just so we're clear. And I think that will be it for the day. Let me check the comments here. Jonathan says AMFT has open comments up on Code of Ethics for this Monday, especially the AI thing. Talk to your orgs and therapists. Exactly. Yeah, we gotta talk. If you're a clinician of some kind, talk to your board of psychology, etc. about this. This is a huge problem. It should not happen. No AI in therapy ever. Not okay. Just not okay. All right, folks. I think that's it for today. So thank you so much for watching and commenting. All the folks who showed up to chat, thank you for being here. I appreciate your support. I appreciate having an actual conversation. And let's keep this going. Let's keep this ship going. Please like, share, and subscribe. Get this out there to more people who either need guidance towards better mental health work, or people who are in the profession, people considering their profession. I want to be a good resource for consumers of all kinds. So the spirit of this podcast, in case it needs to be said again, is I am here to educate and highlight the bullshit in the profession so that therapies can actually work, so that we can use these skills, use these techniques in a way that actually helps, and people can see the difference between bullshit and effective clinical work. So we can see the gurus for what they are and see the actual professionals for what they are. Because I want to protect the consumer, because people should not be hurt by us. They should be helped by us. So that's the reason this exists. Thank you all for being here and sharing. Thank you, Mountain Girl, for showing up and commenting, saying hi. And if you need anything in the meantime, find me on Twitter at Dr. Lockwood. And as always, I like to end this show with a joke of sorts if I can. So I'll see if I can do my best to be funny in some way, but I don't know if I can. Let's see how this goes. I don't know if it's going to work, but I'm going to try. I have this new format for jokes, so maybe it'll work, maybe it won't. Who knows? So I once had this patient who was terribly afraid of going to the doctor. Now, some people have like medical anxiety. Some people have like an actual phobia of needles or the doctors, and so it's not weird. But anyways, this patient was like terribly afraid of going to the doctor. And when I asked them some more questions in the intake session, they said they're afraid of being x-rayed. And I think in 15 years, I've never heard someone say they're afraid of x-ray machines. I think they're mostly harmless. You do them once or twice in your life or whatever, not a big deal. And so when I was talking to this patient in the initial session to kind of get to know them and talk about it, they said they're afraid of x-rays. So I said, well, what's so scary about x-rays? And the patient said, well, I'm afraid that they would actually see right through me. All right. Have a good day. Take good care of yourselves. And I will see you next week.